My name is Dr. Fatima Khambaty, and I'm a general surgeon. I'm here to welcome you to our Hernia Week. For those of you who don't know, we actually have a worldwide Hernia Week, which emphasizes the importance of this condition. It's commonly found in West Africa and other parts of the world, and it's predominantly seen in men, but we can see it both in men and women. A hernia is a bulge. People call it a lump. It's something that you see bulging out of most commonly your groin area, your belly button area, any part of your abdominal wall, and it can cause pain. More significantly, it can cause a problem where it traps a piece of your intestine and cause a life-threatening problem. It's actually 11% of all global disease processes, and most significantly, it prevents people from working. So that means a farmer can't get to work. That means somebody sitting at an office desk has difficulty day to day. These are things that are easily preventable and easily fixable. These things are easily solvable, and most commonly it involves a surgery because it is a structural problem. So in plain English, it's like a hole in the roof. You need to solve that with a patch. The way we do a hernia operation is fairly straightforward. Mostly takes about half an hour to an hour, and you can go home the same day. Commonly, we use something called a mesh, which looks just like a piece of mosquito netting, and that gives strength to the area that's weak. It is a surgery, but you don't have to go fully asleep. We do that every day, all day here, and there's different techniques we can do. We can do a technique called laparoscopic hernia repair, which means in English, we give you small cuts, small pain, and a quick recovery. That aside, we can do a traditional incision, which is a cut about this big in your groin, and we solve the problem that way. Takes about an hour, you go home the same day, and that problem is solved. So what happens when you don't fix a hernia? It can get bigger and bigger and bigger. It can prevent you from walking well. It can prevent you from enjoying life, doing your job, all the things we want to do day to day. What age groups can you see hernias in, and what genders? You can see them in men, you can see them in women. Generally, men get them at a much, much higher rate because of anatomy, the way men are born, but we also see them in children as well. Commonly, we see this in kids, and we especially tend to see it in West Africa. Where do the kids get it? They get it at the belly button, known in medical terms as the umbilicus, and they get it in the groins. When kids cry, they go to the toilet, or they even scream, you can see a little bulge in the groins. This needs to be fixed after the age of 2. It doesn't interfere with reproduction, but it can certainly interfere with normal development and a child even walking well if the hernia gets too big. It can affect self-esteem, and it can certainly affect adult life in general. Do women get hernias? Sure. Women can get hernias after cesarean sections, after other surgeries, and you can get hernias just from being too skinny or too big. So we see this at the extremes of body shape. They're fixed in a similar fashion depending on where they are. Generally, a hernia does need a piece of mesh if it's going to be fixed best the first time around. This has been used for the past 20 years globally, and we do that here. Many people have doubts about the use of mesh. This has been something that has been used from Bangkok to Paris and for the past 20 years. What the mesh does, it gives you strength that your own body doesn't have. That's why you have the hernia in the first place. So that patch goes over the hole that is the hernia, and we secure it into place. We do 90% of our hernias with mesh, so I know that when I've done your hernia repair, it's the strongest it could possibly be. So what are the symptoms of a hernia? Most people describe it as discomfort, not pain. You feel something bulging when you cough, use the toilet, you strain, or you sneeze. And it prevents you from perhaps walking fully upright or really enjoying the activities you want to enjoy, like running, playing sports. As they get bigger, it can cause more of a problem. Then it can be visually displeasing. When somebody sees a large bulge, either in the scrotal area or the area of the groin in a woman, it can cause panic and fear. This can be a hernia. If left untreated, the hernia can get bigger and bigger, and it's simply because it's more difficult to treat. It can trap a piece of the intestine or another organ. In women, it can trap the ovary or even the colon, which is the large intestine. That can take a relatively easy, small half-an-hour procedure to a much bigger one. That's what we want to avoid. If you have any doubt that the condition you may be experiencing is a hernia, whether you're a man, a woman, or you're concerned about your family member or your children, find me on social media. We'll take a look and we'll tell you what it is.